So FTWW, or Fair Treatment for the Women of Wales, is a patient-led women's health equality charity and disabled people's organisation. So we support, advocate for and empower women and people registered female at birth across Wales who are disabled and or living with chronic or recurrent health conditions. Through our online community and in-person activities, FTWW offers a safe space for patients to access peer support, advice and guidance. But crucially, we also enable our members to have their voices heard by Welsh Government, Welsh Parliament committees and healthcare providers, sometimes using the media as a vehicle through which to highlight the issues patients report to us. Next slide, please. A great example of where FTWW's patient advocacy and relationship building with Welsh Government has paid dividends is a campaign we initiated in April called Adenomyosis Action in Wales. So adenomyosis is a very common gynecological disorder affecting at least 1 in 10 women, girls, and people who menstruate. So that's a similar number to those who are affected by diabetes or asthma. Debbie and I are amongst those who have lived and struggled with this condition. And chances are you know many more, even if they haven't been formally diagnosed yet. Adenomyosis can cause significant pain, heavy bleeding, and fatigue. In most cases, it is only formally diagnosed when patients undergo a hysterectomy, an operation to remove their womb. Despite its prevalence and impact, very few have heard of it, and until April 2024, there was no information about it on the NHS Wales's own website. I'll now pass you over to Debbie. Next slide, please.
Thank you, Dee. So over the 10 years that FTWW has been active, we've heard countless and repeated stories from our members about how their various symptoms were not taken seriously by those around them, or how their diagnoses were never fully explained to them by healthcare providers. As Dee has mentioned, many adenomyosis patients are diagnosed following a hysterectomy. This is a major operation and often a last-ditch attempt to resolve seriously debilitating symptoms. One of our members described her experience like this. My surgeon gave me a big thumbs up because I was actually desperate that they did find adenomyosis. We were hopeful that it was causing most of my problems, and I was having a hysterectomy based on that theory. When it was confirmed, it was a massive relief. The validation was so important too, especially when you've spent 20 odd years being told there's nothing wrong with you. So for FTWW, it seemed very wrong that patients could struggle in ignorance for years with what is a fairly common condition, and then when it was diagnosed, be unable to find trusted information about it on what is often a first port of call for health information, the NHS. To address this injustice, for April's Adenomyosis Awareness Month, we decided that FTWW should petition the Senedd to call for information about the condition to be added to its bilingual NHS Wales online A to Z. Following the publication of our petition, concerted social media activity, and making Welsh politicians with an interest in women's health aware of our campaign, it was discussed in plenary, which is where Senedd members from all political parties in Wales come together to debate issues of the day. The campaign then also featured on Wales's national television, radio and online news, where our members and Dee described their experiences and what we would like to see happen next to improve things. The Cabinet Secretary for Health and Social Care, Eluned Morgan, responded by immediately issuing instructions for the missing web pages to be added, which you can see on our slide. We say that the petition achieved its aim far quicker than we had anticipated. So, in fact, it had only garnered a few hundred signatures at the time action was taken. But this proves how it's not always the number of signatures that makes the difference, but the power of the network you've spent time and effort developing. If you can get your campaign seen and heard by the right people, or people who know or can influence the right people, you can make change happen. So don't be deterred. It's for this reason that we were really pleased to be invited by Rosa to showcase Adenomyosis Action in Wales and try to summarise our key takeaways from it. Could I have the next slide, please? Firstly, the campaign was timely, taking place at the same time as an international awareness-raising month for the condition and in response to our members' experiences. It demonstrates the power of patient voices, not just in terms of making big societal changes, but also to the individuals themselves. Members who shared their stories with us in the build-up to this campaign have been empowered to become FTWW volunteer champions on the condition, representing themselves and others at events and activities where healthcare is discussed and delivered. It demonstrates the importance of taking time to build positive and constructive relationships, which for us include Senedd members, ministers, healthcare providers, and the media, to ensure that our members' voices are actually heard. It also serves as a great example of how we want the upcoming NHS Wales Women's Health Plan to be created, together, in collaboration with public and patients, so that it genuinely reflects our priorities and needs. And I'm now going to pass back to Dee to conclude. Next slide, please.
Thanks, Debbie. So we know that statistically, some of you will be listening thinking, those symptoms sound like mine or like someone you're close to or work with. So please do seek medical advice and do feel free to reach out to FTWW as well for support or signposting or just to find out more about our work. Thank you so much.